Welcome. Today we're diving into a rare but fascinating neurological disorder, Dok-7 congenital myasthenic syndrome, or Dok-7 CMS. This condition affects the communication between nerves and muscles, leading to weakness and fatigue. Join us as we explore its causes, symptoms, diagnosis, and the journey of those living with this syndrome. Dok-7 CMS arises from genetic mutations, specifically mutations in the Dok-7 gene. This gene provides instructions for making a protein called Dok-7, which plays a crucial role at the neuromuscular junction. The neuromuscular junction is the critical area where nerve signals transmit to muscle fibers, allowing for voluntary movement. Mutations in the Dok-7 gene are usually inherited in an autosomal recessive manner, meaning that an affected individual must inherit two copies of the mutated gene, one from each parent. So, what exactly does Dok-7 do? The Dok-7 protein is essential for the proper clustering and maintenance of acetylcholine receptors, or HRs, on the muscle cell membrane. HRs are the receptors that bind acetylcholine, the neurotransmitter released by the nerve to stimulate muscle contraction. In Dok-7 CMS, the mutated Dok-7 protein is unable to effectively cluster HRs. This leads to a reduced number of functional receptors at the neuromuscular junction. With fewer receptors available, the muscle is less responsive to the nerve signal, resulting in muscle weakness and fatigue, which are hallmarks of the syndrome. Dok-7 CMS is a rare disorder. Because of its rarity, precise data on its prevalence is limited. It's estimated that it affects only a small number of individuals worldwide. It's also worth noting that Dok-7 CMS, like other congenital myasthenic syndromes, can affect people of any ethnicity or geographic location, although some specific mutations might be more prevalent in certain populations. Now, let's talk about what Dok-7 CMS looks like in real life. The signs and symptoms can vary in severity from person to person, but some common features include muscle weakness, particularly affecting the limbs and face. This weakness often worsens with activity and improves with rest. Infants might present with feeding difficulties, weak cry, and floppiness. Older children and adults may experience difficulty with activities such as walking, running, or even holding their head up. Facial weakness can lead to drooping eyelids, also known as ptosis, and difficulty with facial expressions. Some individuals may also experience breathing difficulties, especially during periods of exertion or illness. Diagnosing Dok-7 CMS involves a combination of clinical evaluation, genetic testing, and sometimes electrophysiological studies. A doctor will begin with a thorough medical history and physical examination to assess the individual's symptoms and muscle strength. Electrophysiological studies, such as repetitive nerve stimulation and single-fiber electromyography, can help assess the function of the neuromuscular junction. Genetic testing, specifically sequencing the Dok-7 gene, is essential for confirming the diagnosis by identifying the presence of mutations. Muscle biopsies are rarely needed but can be used in special circumstances. While congenital myasthenic syndromes have various subtypes based on the gene affected, Dok-7 CMS is specifically defined by mutations in the Dok-7 gene. Therefore, it is one distinct form of CMS rather than further classifiable into different types within itself. Unfortunately, there is no cure for Dok-7 CMS. However, treatment focuses on managing symptoms and improving quality of life. One of the primary treatment options is the use of medications called cholinesterase inhibitors. These drugs help increase the amount of acetylcholine available at the neuromuscular junction, thus improving muscle strength. It is important to note that some patients may not respond well to cholinesterase inhibitors and may experience side effects. In such cases, other medications, such as ephedrine, may be considered. Physical therapy is also an important component of management. Regular exercise and stretching can help maintain muscle strength and prevent contractures. Assistive devices, such as braces or wheelchairs, may be necessary for some individuals to aid with mobility and independence. Regular monitoring by a neurologist or neuromuscular specialist is crucial to adjust treatment as needed and manage any complications. As Dok-7 CMS is a genetic condition caused by inherited mutations, there is no direct way to prevent its occurrence. However, genetic counseling is recommended for families with a history of the condition. Genetic counseling can help couples understand the risk of having a child with Dok-7 CMS and explore available reproductive options, such as preimplantation genetic diagnosis. The prognosis for individuals with Dok-7 CMS can vary depending on the severity of the condition and the effectiveness of treatment. Some individuals may experience mild symptoms and maintain a relatively normal quality of life with appropriate management. Others may face more significant challenges and require ongoing support. Recent research is focusing on understanding the precise mechanisms by which Dok-7 mutations affect neuromuscular function. This knowledge is paving the way for the development of novel therapeutic strategies, such as gene therapy or targeted drug therapies. While these approaches are still in the early stages of development, they hold promise for improving the lives of individuals living with Dok-7 CS in the future.